disabilities. So I thought today we'd talk about why is autism in the news, why is it so trendy, what do people mean, or review the definition of autism, to think some too of what's the core feature. If somebody says they know somebody or a child is struggling with an autism diagnosis, what's that core feature look like? And finally, to think about how we here at the Center for Children and Families want to offer families hope through early intervention. I don't have a lot of time, so I'm going to try to talk fast, but we're going to save some questions for the end. But since 1960 to 1990, California has collected the data on kids getting services for a variety of developmental disabilities in the state of California. California now represents 1/4 of the US population, so it's a lot of kids. And from the 60s to the 90s, a rapid rise in autism. In the 60s and 70s, when there was a child with autism admitted to the hospitals, everybody would gather around because this was our chance to see that one child and very few who struggle with this diagnosis. But now you go to a playground, Educare, a school center, there's kids right and left where the families are saying that the diagnosis has been a term that their pediatric providers used. So we should talk about, is there an epidemic? You've heard about it on the news, I'm sure. Some people are worried about why is this change? Where are all these kids coming from? And is it certainly in the news talked about, is it related to the vaccines and all the vaccines kids get? Or is it related to the thimerosal or the mercury that's used in the preservative for those vaccines? I could name all those celebrities that have weighed in on this, but I'll stay away from that. Could it be just a better case definition that we know more, which is what we're going to talk about next. We know more what autism is since the 60s and what it isn't, and we're better able to clarify who has it and who doesn't. Or it could be perhaps better recognition, that training that Erikson does to child care providers, and you saw it, Educare, people who work in schools, medical providers, all the people that Erikson touches, are they now just more informed about what autism is, and are they better sending kids into services? Or could it be just early intervention works? We know since the 60s and now 2009 that the value of early intervention, starting early and intervening for kids who have struggles, and how valuable that is. Could that be getting kids into the system more? This is new California data to show you now 1/4 of our population from 1995 to 2007. And the top line is just the births, but the bottom line are the kids with autism in the state of California. And you can see, unlike the 60s to 2007, the line is increasing steadily year by year. So it's tough to deny that autism is increasing over time. One of the reasons I showed this was to take on the first two things we just talked about, whether it's the vaccinations or the mercury in the vaccinations. In 2001, right here in the middle, the government eliminated all mercury from childhood vaccines. And so the hope was that we'd see the rise, if it was caused by mercury, we'd see the rise go up and then be blunted because this heavy metal have been eliminated from the children's systems. But as you can see, there's still this steady increase of kids across the phone. So it's very clear the rates of autism and the rates of families who have been told their kids have autism, or another term called pervasive developmental disorder, are higher over time. But vaccines aren't playing a central role in this, and that's been widely reported in the news. I think one of the things that we want to talk about, and we're going to lead us to the next slide, is that many children who don't have severe or formal developmental disabilities are now included in this autistic spectrum or autistic diagnosis. And these pictures help me describe that. On the right side is a child who maybe in the 60s or 70s we would have recognized as autism. A child who doesn't talk, who doesn't really interact with his environment, who's really substantially separated from the other kids, maybe had to live in an institution because the developmental disabilities were so severe. But now kids in 2009 are going to school and are in the mainstream classroom. They don't look as if they're substantially separate from their kids. They need some supports. We'll think about what those supports are, but they're part of the mainstream educational system. And those kids are now being included in the autism diagnosis. So it's important for us now to review what we mean by when we say autism. And autism is a series of diagnoses that cover these categories. The most formal diagnosis is called autistic disorder, and it has a set of criterion that a child has to meet or not meet in order to acquire that diagnosis. Unrelated, but not exactly like autistic disorder, is called Asperger's disorder. And that's a diagnosis that applies to older kids or kids who struggle when they get older in life. A term that I don't like a lot, but it's in part of our language, is called pervasive developmental disorder not otherwise specified, which is much like the autistic disorder, but it's a milder form. It's children that don't meet the most formal criteria of autism. Two other diagnoses that are under the autism umbrella are called childhood disintegrative disorder and Rett's disorder. And those are completely different disorders that the children don't appear to look like or have the same developmental challenges, although they're significantly developmentally delayed as the children who have autism. So we like to use the term autism spectrum disorder, and autism spectrum disorders are under an umbrella. And here are the 5 terms listed under the umbrella, but I take out the 2 that really don't apply to autism. In autism really are now 3 core diagnoses. It starts at one end, autistic disorder, and the other end is pervasive developmental disorder not otherwise specified, and somewhere in the middle are kids that acquire the diagnosis of Asperger's syndrome. It's very confusing to families, it's very confusing to medical providers, and so that's what we do a large part here at Erikson, to try to help people figure out what are these terms and how they best apply.